If you're horrified about getting mastitis, your breasts are firm, sore, lumpy, you've come across to the perfect video. Save this video, send it to your friends. We're going to talk about 9 massages you can do and what not to do to prevent mastitis. My name's Amy. I'm a lactation consultant that works in a maternity hospital. We often educate women about preventing mastitis, assessing and de-escalating sudden presentation of inflamed breasts, and we work along doctors and surgeons to provide additional input about breast care. Number 1, arm stretches to increase circulation. We're going to do 10 big arm stretches before you feed to increase your circulation, because usually when you have plugged duct, you have more swelling in your breast. Your breast tissues will feel tight, and we want to move the swelling away from your breast. That's going to help you with your overall comfort and the firmness of your breast. Number 2, we're going to do lymphatic massage. Lymphatic massage is a very easy exercise that takes 1 to 2 minutes, and the goal is to remove swelling away from your breast so that your ducts have more space to open up and that your milk can flow out of your breast. Usually when you're feeling either heat, firmness, hard lumps, or severe pain to the point that you're concerned about getting mastitis, it comes with a lot of swelling. Your breast probably feels like a swollen ankle, but also within a lot of milk inside of it. When you have a lot of swelling in your breast, your milk ducts where your milk travels out of are probably more squished and under pressure. So our goal with the lymphatic massage is to release some of that pressure so that your milk can travel out of the duct smoothly. To perform the lymphatic massage, you need to use the flat surface of your hand and do very gentle strokes towards your armpit and your collarbone. You want to scoop around your entire breast, especially around where there's a lot of swelling and around the lumps. And you want to be as gentle as you can, only penetrating through the top layer of your breast and not digging in, because your swelling only sits on the top layer. If you want to understand more about the lymphatic massage or you're not sure how to do it, watch this video about lymphatic massage. Just remember, lymphatic massage is very different from deep tissue massage, and the pressure is very gentle, like the pressure you would use to stroke a baby's hair. Number 3, breast gymnastics for comfort. When you have mastitis, you're most likely making a lot of milk for what your baby needs. If this is the case, you don't want to be aiming to empty your breast after breastfeeds, because your breasts are always generating more milk. Removing a lot of milk and stashing them in a freezer because your baby's not drinking it is only going to trigger an oversupply and increase your risk of mastitis in the long run. Breast gymnastics is perfect for when your breasts are feeling very sore and uncomfortable, and by performing this motion, it can help relax the connective tissues called fascia in your breast, just to buy you some time and give you a temporary relief so that you can wait till the next feed instead of expressing straight away. To perform the breast gymnastic, you want to use both hands to support the very base of your breast, and you want to move your breast as a whole against your chest wall. Try to avoid using your fingertips to dig in and press into your breast tissue. Imagine that your breast sits on top of your chest wall. We're going to move your breast up very slowly and down and left and right. And we're going to do that one more time. Top, down, left, right. And then we're going to do 2 circles in one direction and 2 circles in another direction. Now, close your eyes. Your breast should feel a lot more relaxed after this quick session. You can do this as often as you want to because you're not actively expressing a lot of milk, and is a really good practice for comfort measures. Number 4, leaning over and jiggling. This is a funny one, but it really works. When you feel the hard lumps in your breast, that means your milk has been sitting in there for a while, or you're making a lot of milk there. The longer it sits in there, the harder it is for the milk to come out. This is what I love recommending for everyone with concerning lumps in your breast. You want to do this after your arm stretches, after your lymphatic massage, right before you feed baby. You're going to cradle your breast and lean over and really just jiggle and vibrate your breast. Or just trying to jiggle, move the milk around so that when you're feeding baby or when you're expressing, the milk travels out smoothly. Number 5. Reverse pressure softening or correct flange sizing. If your areola is quite swollen and you feel that your baby's latch is not as deep since your milk has come in, it's very important that you do this to deepen the latch for both your baby's orofacial development and your nipple's sake. A deep latch when you're breastfeeding means that your milk is better removed from all areas from your breast rather than just a certain area of your breast. Reverse pressure softening or hand expressing before a feed can help to soften the areola and promote a deep latch. You can also do this if you're exclusively pumping. Using the correct flange sizes when you're pumping, it's really going to give you the most comfort and effective milk removal, which is so important for preventing mastitis. Number 6, gentle taps, tiny circles, and breast compression during milk removal. Often I see people massaging their breasts a lot when they're not even feeding. Honestly, I don't think that makes a huge difference. Just imagine this. Your breast is like a broccoli. When you feel the lumps, that means your breast is storing a lot of milk there in the lumps. The only way for your milk to come out is when you're feeding and your baby's sucking or when you're pumping. The milk travels slowly out of the duct and out through your nipple. So really, your milk only has one way out. When you're massaging your breast and doing little circles and rubbing this lump when you're not feeding, the milk is not actually going anywhere. So then we're not actually fixing the root of the problem, which is the buildup of the milk. You want to focus on doing these little massages while you're breastfeeding or pumping. My favorite thing to do is little taps on wherever the lump is while you're pumping or breastfeed. And the pressure is very, very gentle. You're not digging into your breast or the deep muscle, as that's just going to cause more inflammation and swelling. So don't do this. And it's really, really gentle pressure when you're tapping those lumps, or really, really gentle circles just on the surface of your breast. You definitely don't want to use your knuckle because often that's how people end up getting a lot of redness, which then causes more swelling and bruising down the track. Or you also don't want to use your direct fingertips to do a very firm massage. Number 7, ice to your breast. Your goal is to have these little lumpy areas feel just a little bit softer or smaller after a feed compared to right before this feed. Putting ice and cool packs on after the feed to calm down your breast tissues can help you reduce swelling. Additionally, you can do 10 small circles with medium pressure at the junction of your internal jugular and subclavian veins. You can also do 10 circles in the axillary. This is a part of the recommendation of lymphatic massage from the Academy of Breastfeeding Medicine. What not to do to avoid mastitis is not putting heat directly on the lump and no massage with your knuckles or fingertips pressing into your breast. Imagine putting heat on a swollen ankle. That's not going to really help you with the swelling and the inflammation, is it? However, heat on your neck, your shoulder to help you relax when you're feeding them or pumping can be very helpful. If you're not sure if you need to express, whether you shouldn't express, if you want to understand the key concepts of mastitis and how to prevent mastitis, please watch part 1 of this video where we discuss the underlying concepts, and there are 6 extra tips to help you further prevent plugged duct and mastitis. Remember, you don't need to do every single step mentioned in this video before every single breastfeed. Just understand what each step is for, and you can customize the routine to suit your needs. If you have a fever or feel severely unwell with flu symptoms, it's still very important to seek medical advice from your GP or go to the hospital. Everything mentioned in the video today are suitable if you currently have an inflammatory or infective mastitis, but may not suit you if you have recently had breast surgery or an active abscess. What really is going to prevent mastitis is good breastfeeding practice and managing supply. If you want to see a virgin without all the explanations, I'm going to post a breast massage follow through for you. And we're going to put these steps in order and practice all the steps together with me before and during each feed. So subscribe, save this video, and I will see you in the next one.